Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. I'm Lindsay Smith Rogers, producer of Public Health on Call. Our last episode of 2022 will be December 16th. We'll return with a new season of the podcast on Wednesday, January 4th. In Season 7, we'll be launching Climate Mondays, a series of episodes dedicated to hope and change. Guest host Shelley Hearn, director of the Johns Hopkins Lerner Center for Public Health Advocacy, will talk with leaders working at the intersection of climate change and public health, doing innovative work with the through line that we can do something about climate change. These conversations are fun and engaging, and we hope they'll bring fresh energy to an often daunting topic. We'll also continue to talk about COVID and other infectious diseases, aging, mental health, solutions for gun violence, and more. And of course, we'll continue to cover the need for investments in public health infrastructure and surveillance for future pandemic threats. A few thank yous as we wind down this season of the podcast. First, to our interns, Kriti Baum, Caroline Wang, and Hannah Bennett, who bring fresh ideas and much-needed support for the team. We'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast nearly 10 million times. We appreciate all the great ideas and questions that come from you, so keep writing us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu. Thank you for being part of this podcast. Today, we hear what the winter may have in store for us. Our guest is Dr. Sean Truelove, who runs the Johns Hopkins Modeling Hubs, which bring together projections from researchers across the country. Dr. Truelove returns to the podcast to speak to Dr. Josh Sharfstein about what these projections are saying for COVID, for flu, and for RSV in the days and weeks to come. Let's listen.
Sean Truelove, thank you so much for coming back to the podcast to talk about the latest models of respiratory disease. Let's start with COVID.
Yeah, thanks for having me. It's great to be back. We completed another round of the scenario modeling hub for our COVID. This was round 16. And this time we were trying to look at some of these new variants that are coming out. We've stopped designating them as Latin letters. Is that right? Is it Latin and Greek? Greek letters. It's been too long.
Greek letters.
And now they're kind of considered by the number of mutations that they have. And so they've been designated by different people as different things. But one of the kind of leading ways to designate them is these levels that are based on the numbers of mutations. So we were looking at what's called level 5 and level 7, 6 and 7 variants. So level 5, this captures some of the variants that people are hearing about, the BQ1, whereas the level 6 and 7 captures some of the other variants like the BQ1.1, the XBB, and some of these other deviants of those. And these really are being characterized by their ability to escape immunity in the population, which is really what's protecting us right now. We've just developed so much immunity. And so these new variants are continuing to emerge, and we're trying to understand what the impact of these potential, immune escape characteristics might be coming into the winter season, where we've got, flu and RSV and everything everybody's talking about also happening at the same time. And so looking at those variants along with levels of the impact of boosters, specifically the new bivalent booster, we are projecting that while we are, much reduced compared to previous winter peaks, potentially even the previous summer, we do expect to see a fairly large increase in the number of hospitalizations this winter. But we're already starting to see it go up quite a bit right now. And so, we're not quite out of the woods with this thing.
Yeah. What are the key factors that you're looking at to determine whether this could be a very bad winter versus, from a COVID perspective, we'll just start with COVID, versus a challenging winter?
Yeah, so I think it's really being driven by these variants. We have a pretty good sense of the vaccine right now. There's a couple new reports that have come out, one from MMWR, that have shown that the new booster does have some additional advantage compared to the previous monovalent boosters. And of course, just getting a booster in general re-ups your immunity, which we know wanes pretty quickly at this point. So that's a part of it, but really it's these new variants, and we're constantly monitoring them. Just which ones are kind of taking over as the dominant strains.
So where they project variants with more immune escape, where you're seeing more hospitalizations, and I'm looking at the model here, really into March, it looks like, even April.
Yeah, right. And there's a lot of factors that are contributing to that. What that timeline looks like. I think the March or April kind of timeline is probably less likely. It really depends on how much infection occurs this winter as to what happens later. So, if a bunch of people get infected in the next month or two, we're going to be less likely to see something in the spring. And it currently is going up. We're seeing quite a bit of rise, and there are certain states that it's even more pronounced in. California is seeing a really rapid rise right now. They are currently at the number of hospitalizations that they saw during this summer when the BA4 and 5 variants were taking over, and they are continuing up. So I think that might be a picture of what's to come in other states as well.
Got it. So I would say not great news and possibly worse news depending on what the variants do. What about the flu situation?
Yeah, so flu, I think everybody's talking about that right now with the twindemic and potentially the tripledemic with RSV. We are projecting flu to be a pretty substantial season. Right now, the empirical data, the hospitalizations, are tracking pretty well with our most pessimistic scenario, which is basically defined by the fact that there is very little immunity in the population because we haven't been infected in the last couple of years. And so what we're seeing with those projections is that we're expecting a much earlier season, which we already know is happening, and a much larger season than we're used to seeing. So our previous worst season, we experienced, somewhere around 37,000 hospitalizations in the peak week. We're expecting it to be substantially larger, potentially up to about 46, 50,000, with the potential for even larger numbers than that.
I mean, I am not so old that I don't remember when flu alone could tip over the healthcare system.
Right. And the combination of the two is pretty daunting. And we've ran the numbers, we've combined them from our projection rounds, and we're seeing potentials of 60, 70,000 hospitalizations in the peak week towards the end of December.
And, that's enough in some places to really fill up every bed and beyond.
Yeah.
What about RSV? How does that factor in? Do we see a lot of obviously for children, it's a frequent cause of hospitalization, and, pediatric hospitals have been reporting that for a number of months now. What about for adults, and how does that affect the overall picture?
Yeah. So the good news with RSV is that it does look like it's trending down already. It seems to have had its season a bit earlier than the other two viruses. So there's hopefully not going to be kind of that synchronization of peaks, which is really the scary thing that's, I think, starting to happen with COVID and flu. And because it's a different population, especially with COVID, it's not affecting the pediatric population nearly, to the extent that RSV or flu might. And RSV doesn't generally send, many adults to the hospital. So that's good news. But we're still seeing this heightened, like you said, like the pediatric hospitals are pretty overwhelmed right now. And so it's, I think we're going to have a lot of tired healthcare workers and tired parents as well.
Yeah, sounds like this is going to be a difficult few months. Sounds like there's every reason to get the new booster if you haven't gotten it, and every reason to get a flu shot.
Absolutely. They're our best protection. And actually, the good news with that is that the reports out on the vaccine effectiveness for flu are really good. This is one of the best flu vaccines we've seen in years. So that's really good news. And like I said, the bivalent booster does show pretty good improvement over the previous booster. And we do know that, getting a booster re-ups your antibodies and your immunity. So it's a really good idea. Even if it doesn't prevent you from getting infected, it's going to keep you from having a serious illness, or even an annoying one where you're out of work or tired and not feeling well.
At least for a little bit of time there. Well, I am going to take that as the high note. I think that's about as high as we're going to get in this podcast. And thank you, Dr. Truelove, for coming back to Public Health on Call and telling us what your many models that I know you assemble from all across the country, what they're telling us about what might happen. Thank you.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.